acute stroke team to accident and emergency, ETA 5 minutes.
Alright guys, so it's finished with a CT scanner. So in this little clip we saw at the beginning, so we see the ambulance coming, we see the pager ringing, calling the acute stroke team to come into the accident emergency because there's a stroke coming in their way. And the little clip is finishing with a CT scanner. What does that mean when it's finishing with that? It means that in a stroke, there are two vital imaging investigations we can do in order to help the patient. One, and the first one we do, it would be a CT scanner or an MRI scanner, but most hospitals at the moment, in first instance, they do use a CT scanner first, and then an MRI scan to diagnose the stroke if the CT comes back clean. So why do we do a CT scan first when the patient comes with an acute stroke within the hospital grounds? So main thing, one of the first CT scans were done in around 1972. One of the creators of the CT scanner is Sir Godfrey Hounsfield. And also when you look at the CT scan, the units that you measure the slices and unit that you measure in the CT scanner is Hounsfield units from Sir Godfrey Hounsfield. So why do we do a CT scan in the first place? We do it because we need to rule out, in first instance, any hemorrhagic stroke, any bleed in the brain. So when you have two types of strokes, one is ischemic, which is a clot that is stuck in the vessels and is creating a blockage. The blockage creates an ischemic event within the brain. A hemorrhagic stroke is when the vessel bursts and creates an hemorrhagic stroke. Usually is due to hypertensive crisis. Uncontrolled hypertension, basically. So what do we do in this case? Why do we do the CT scan? The CT scan is done to rule out any bleeding in the brain. And if you do the CT and the CT is clean, like the image right here, you continue with a CT aortic arch and carotids to see if there's any large vessel occlusion. And that's done with contrast solution using the CT scanner. If the CT comes out with a hemorrhagic stroke, like you see in this video right here, where you see it in the left, right posterior region of the brain, looks like a fire globe, or sometimes they also say it looks like a grenade that explodes. Is basically when a vessel erupts because of the blood pressure. You see this type of white flame ball showing up in the CT scan. In this distance, we don't do a CTA anymore. We don't do a CT aortic arch and carotids. We stopped at the CT head. We don't want to put any contrast in the brain when the brain is leaking blood. So in that situation, you do refer the patient to a neurosurgical team to see if they can intervene and drain the blood if it's possible, and if the benefits outweighs the risks, because there is a risk when you do that. When the radiologist and radiographers, radiologists look at a CT scan, they use a systematic approach when they visualize the scan. The approach, it stands for ABBCS, where A stands for symmetry. They take the CT scan, they split it in half. Like imagine you have the scan, you split it in half, and you have two sides, yeah? So you have the left and the right, and they need to look for a symmetry. If they see anything different from left to right, that could be something that it's not right in the scan. But now recent studies said that the brain is not quite 100% similar, left hemisphere with the right hemisphere, but it still needs to be kind of probably 90-95% of the tissues similar. So that's letter A for asymmetry. The letter B stands for blood. They look for any blood and any hemorrhagic element in the brain. So they look for a hemorrhage, a vessel that bursts. They look subarachnoid hemorrhages. They look for any tumors that bled, anything like that. And then the second B stands for bone. They look at the bone of the skull to see if there's any cracks, to see if the patient had a fall. They look at the bone of the skull to make sure there's no fractures. The letter C stands for cerebral spinal fluid. So they look if there's any cerebral spinal fluid where it should not be, or if it is in the right place. And the S stands for skull. So they look at the skull to see if it's symmetric and if there's anything wrong in it. So that's A, B, B, C, S. That's the systematic approach radiologists are using in order to assess a CT scan. And probably in the MRI scan is the same. So how is the CT scan working? How do we get those images? We do get the images in using, basically, CT scan uses radiation, so it uses X-rays, multiple X-rays. So when you put a patient in the CT scanner, there's this machine that looks like a donut, yeah. So when you put a patient inside, you have a lot of X-ray images going around the body of the patient, creating slices of the imaging in order for us to see the scan like in real time, like a video format. So when you scroll the wheel of the mouse, you can see the slices going quite fast. There are a lot of slices of imaging, creating a whole picture of the brain. So it was created in 1972 by Sir Godfrey Hounsfield alongside with his friend. His name is Alan Cormack. Pretty much that's the main reason we use the CT scanner. If you have any relatives, any friends that suffered unfortunately a stroke and you see they're rushing them through a CT scanner, that's what we're doing it for. That's the reason why we are rushing it. Remember, time is brain. Every minute, most likely around 2 million neurons, brain cells are dying. So we need to rush them in the scanner to see if the patient had a hemorrhagic stroke or ischemic stroke. If it's ischemic stroke, we have medications to give in order to destroy the clots, re-establish circulation in the vessel, trying to heal the penumbra of the infarct and save as much as we can the patient's mobility and deficits that he has. If it's a hemorrhagic stroke, then we go to a different pathway. We refer to a neurosurgical team, and they will take a decision if it's in the best interest of the patient and if it's not too risky in terms of life-threatening procedure in order to go ahead with it. And that's pretty much it with CT scans. And before we move on actually to the MRI scanner, a very interesting thing if you want to do in your free time, if you go to National Science Museum in London, you're actually going to find one of the first CT scanner made by Sir Godfrey Hounsfield. It's called EMI scanner. So I think that's when the first CT scanner was created, was part of the EMI, where Sir Godfrey Hounsfield worked. And actually, when you go there, you can see the actual machine that was used first time when it was created, and you can see how it looked, how complicated it was to create something like that. And basically, it's used around 28,800 measurements of X-ray imaging in order to create a picture. It's a very interesting thing. So yeah, if you have free time, National Science Museum is the best place to go. You can actually see one of the first CT scanners that were created by Sir Godfrey Hounsfield. Thank you. Now the second imaging investigation, an important investigation we do, it's also the golden standard in how we can diagnose the stroke, and that's MRI scanner. The MRI scan stands for magnetic resonance imaging, and it's a much more enhanced imaging of the brain, and it's not using radiation, it's using magnetic resonance. So we're gonna go through that right now. Alright, the magnetic resonance imaging scanner, the MRI scanner. The MRI scanner, it's much more safer apparently, and it is true though, than a CT scanner, because it doesn't use radiation. It's using magnetic fields in order to produce the imaging. One of the first MRI scanners were built after the CT scanner was discovered, probably around 1980s. There are a few people that contributed to the MRI being invented. But one of the, I believe one of the main builders that focused on human body MRI scanning, it was I believe it was Raymond Demadian, that used nuclear magnetic imaging in order to create this mode of investigation. So at this time, the MRI scanner is considered the golden standard of diagnosis in stroke, because it's using much more enhanced imaging, so you can see the brain much more clearly than rather than using a CT scanner. In a CT scanner, the ischemic infarct, it looks dark, hypodense. And in an MRI scanner, the infarct looks bright, hyperdense when you look at the scanning, and also the bleeding in the brain on a CT scan looks bright, and on the MRI scan the bleeding in the brain looks darker, so it's reversing the colors, well, non-colors basically. When you're looking at the MRI scan, but it's still using the same systematic approach in order to view the scans, but the MRI scanner has multiple ways of seeing the brain. Like you have DWI, the T2 flare, you have different types of imaging options, let's say, like let's put it simpler like that rather than the CT scanner. One of the early models of the MRI scanner, you can also see it in the National Science Museum. It was used in Aberdeen in UK. And if you go there, like you see it up here in the little clip, this is actually one of the first MRI scanners used in UK, and it's a very complex machine, quite hard to build if you look at it, and thumbs up for everybody that worked on it. That's something that changed the history of medicine and gives us extra hand in helping patients that suffers this awful disease. When you do the MRI scanner, because it is a magnetic field device, you're not allowed to get any metals inside with you, because they're gonna get quite hot and they can, you can have incidents with it. So when you go to an MRI scanner, it's advisable not to wear anything metal with you. And also if you have a pacemaker, PPM, it's better to check with the manufacturer to see if it's safe to use an MRI scanner, because some patients, unfortunately, they're not able to have an MRI scan because of the pacemaker, because it's not safe. When you put somebody with a pacemaker and it's not qualified to go through a scanner like this, it might cause a lot of life-threatening issues. So we need to keep that in mind. With a CT scan, it's not magnetic, you can go with metals. The only thing is, if you go with metals in a CT scanner, on the scan you're gonna create like light artifacts that's gonna basically making very hard for us to us more, the radiologists, not us, to review the scan, basically. So it is advisable when you go to a CT scanner, if you have any earrings, take them off. If you have any necklace, take it off. Anything metal, you should take it off either way, because it's gonna damage the image quality. Pretty much, guys, those are the two main imaging investigations we use with stroke. There are others also, but those are the main ones in an acute stroke that we use in order to establish a method of treatment and diagnose a patient with stroke. So you have the CT scanner and the MRI scanner. Thank you very much, guys. Wish you all the best and see you on the next video. Cheers and kind regards.